Question 1. A nurse is caring for a client admitted with acute exacerbation of heart failure. Which assessment finding is the most critical to report immediately to the healthcare provider? A. Weight gain of 1 kilogram over 24 hours. B. Crackles heard in the lung bases. C. Urine output of 40 milliliters per hour. D. Client reporting difficulty breathing and restlessness. Answer: D. Client reporting difficulty breathing and restlessness. This question tests your ability to recognize critical cues and prioritize patient needs in a heart failure exacerbation. The keywords most critical and immediately highlight the urgency of identifying life-threatening symptoms. Difficulty breathing and restlessness are signs of worsening respiratory distress and potential hypoxia, which indicate severe fluid overload impacting oxygenation, requiring immediate intervention. While weight gain, crackles, and decreased urine output are important findings in heart failure, they do not signify the same level of immediate respiratory compromise as difficulty breathing and restlessness. For instance, a client becoming more restless might be a sign of their brain not getting enough oxygen. Always remember to prioritize ABCs, airway, breathing, circulation, when evaluating patient stability. Question 2. A nurse is preparing to administer medications to a client. The client states, "This pill looks different from what I usually take." What is the nurse's priority action? A. Administer the medication as prescribed, explaining that pharmacies sometimes change generic brands. B. Check the medication administration record, MAR, against the medication label and the client's identity. C. Inform the client that they must take the medication as ordered to avoid withdrawal symptoms. D. Document the client's refusal to take the medication and notify the healthcare provider. Answer: B. Check the medication administration record, MAR, against the medication label and the client's identity. This question assesses your understanding of medication safety and the rights of medication administration, particularly the right drug and right patient. The client's statement, "This pill looks different," serves as a crucial cue, prompting the nurse to stop and re-verify the medication before administration. It is a critical step in the medication administration process to ensure patient safety and prevent medication errors. Even if the change is due to a generic brand, verifying against the MAR and the label is paramount, as a different appearance could also signify an error or a different medication altogether. Always remember to trust your patient's observations and use them as a prompt to recheck everything for safety. Question 3. The nurse is caring for a client who underwent an appendectomy 24 hours ago. The client reports pain at an 8 out of 10 on a scale of 0 to 10. Which intervention should the nurse perform first? A. Administer prescribed oral analgesic. B. Reposition the client for comfort. C. Assess the surgical incision site. D. Educate the client on pain management techniques. Answer: C. Assess the surgical incision site. This question tests your clinical judgment in prioritizing assessment before intervention, especially with a new complaint or change in a post-operative client. The keyword first indicates the need for an immediate action based on prioritization. Before administering pain medication for an 8/10 pain, it is crucial to assess the source of the pain and rule out potential complications like hemorrhage, infection, or dehiscence, surgical wound opening. Administering medication without assessment could mask a serious underlying issue. Always remember, assess before you intervene, especially when the patient's condition changes or their symptoms are severe. Question 4. A client with a new diagnosis of type 2 diabetes mellitus is learning to self-administer insulin. The nurse observes the client injecting air into the insulin vial but then drawing up the dose without injecting air into the syringe first. What is the most appropriate nursing action? A. Allow the client to continue, as this technique is acceptable. B. Stop the client and demonstrate the correct procedure for injecting air into the syringe. C. Document the client's incorrect technique and report it to the healthcare provider. D. Provide the client with a written instruction sheet on insulin administration. Answer B. Stop the client and demonstrate the correct procedure for injecting air into the syringe. This question evaluates your ability to recognize a critical error in a teach-back scenario and intervene appropriately to ensure patient safety. The keyword "most appropriate" guides you to the best immediate action for correcting an observed error. Injecting air into the syringe first before drawing up the insulin dose is crucial for creating negative pressure, making it easier to withdraw the correct amount of medication and preventing air bubbles from entering the syringe, which can lead to an inaccurate dose. Directly intervening and re-demonstrating ensures immediate correction of the technique, preventing potential dosing errors and promoting effective self-management. Think of it as a crucial step in ensuring the right dose. If you don't put air in, you might struggle to get the insulin out smoothly. Question 5. A nurse is reviewing the laboratory results for a client with persistent vomiting. Which electrolyte imbalance should the nurse anticipate? A. Hyperkalemia. B. Hypokalemia. C. Hypernatremia. D. Hypocalcemia. Answer B. Hypokalemia. This question tests your understanding of electrolyte imbalances, specifically how significant fluid loss from the upper gastrointestinal tract affects potassium levels. The keyword persistent vomiting is the key clue, indicating a loss of gastric fluids, which are rich in potassium and hydrogen ions. Vomiting leads to loss of stomach acid, causing metabolic alkalosis, and the kidneys try to compensate by excreting potassium and hydrogen ions, resulting in hypokalemia, low potassium. For instance, frequent vomiting often depletes the body's potassium, making the heart more irritable and potentially leading to dangerous dysrhythmias. Remember, think about what's being lost from the body when symptoms like vomiting occur. Question 6. A nurse is caring for a client with Clostridium difficile, C. difficile, infection. Which action is most important for the nurse to take to prevent the spread of the infection? A. Wearing a surgical mask when entering the client's room. B. Placing the client in a negative pressure isolation room. C. Performing hand hygiene with an alcohol-based hand rub after providing care. D. Washing hands with soap and water after removing gloves. Answer D. Washing hands with soap and water after removing gloves. This question assesses your knowledge of infection control, specifically for C. difficile. The keywords most important and prevent the spread emphasize the primary intervention for this type of infection. C. difficile spores are resistant to alcohol-based hand rubs, making vigorous hand washing with soap and water the most effective method for mechanical removal and destruction of the spores. Even after removing gloves, microscopic spores can remain on the skin, so soap and water are essential to prevent transmission to other surfaces or clients. Remember, for C. diff, alcohol-based hand sanitizers just won't cut it, so always use good old soap and water. Question 7. A nurse is reviewing a client's advance directives. The client has designated their spouse as the durable power of attorney for healthcare. The client's adult child requests information about the client's prognosis. How should the nurse respond? A. Provide the adult child with the requested information, as they are next of kin. B. Decline to provide information to the adult child without the client's explicit permission. C. Advise the adult child to speak with the designated durable power of attorney for healthcare. D. Discuss the client's condition with the spouse, who can then relay the information to the adult child. Answer B. Decline to provide information to the adult child without the client's explicit permission. This question tests your understanding of client rights and confidentiality under HIPAA, Health Insurance Portability and Accountability Act, even when family members are involved. The keyword advance directives and the mention of durable power of attorney for healthcare are important, but the core principle here is the client's right to privacy. Unless the client has specifically authorized sharing information with the adult child, or the child is the designated power of attorney, protected health information cannot be disclosed. The spouse, as durable power of attorney, can make healthcare decisions if the client is incapacitated, but they don't automatically override the client's right to privacy regarding other family members. Always remember, without the client's direct consent, assume information is confidential, even from family. Question 8. A nurse is assessing a client with chronic obstructive pulmonary disease, COPD, experiencing acute dyspnea. The client's SpO2 is 88%. Which action should the nurse take first? A. Administer a bronchodilator via nebulizer. B. Apply oxygen at 2 liters per minute via nasal cannula. C. Encourage the client to cough and deep breathe. D. Place the client in a high Fowler's position. Answer: D. Place the client in a high Fowler's position. This question assesses your immediate prioritization in a respiratory emergency for a client with COPD. The keywords acute dyspnea and first indicate the need for an immediate, non-invasive intervention to improve breathing. Elevating the head of the bed to a high Fowler's position allows for maximum lung expansion and reduces the work of breathing by utilizing accessory muscles more effectively. While oxygen and bronchodilators are often needed, positioning is a quick, initial intervention that can provide immediate relief and improve gas exchange before medications take effect. Always remember that repositioning is often a rapid, initial step to improve respiratory comfort before more complex interventions. Question 9. A nurse is caring for a client who is experiencing chest pain suspected to be a myocardial infarction, MI. Which action should the nurse prioritize? A. Obtain a 12-lead electrocardiogram, ECG. B. Administer morphine for pain relief. C. Provide sublingual nitroglycerin. D. Obtain cardiac enzyme levels. Answer: A. Obtain a 12-lead electrocardiogram, ECG. This question tests your ability to prioritize diagnostic interventions for a suspected cardiac emergency. The keyword prioritize emphasizes the most critical first step. An ECG provides immediate vital information about the electrical activity of the heart, allowing for rapid diagnosis of an MI and differentiation from other causes of chest pain. This rapid diagnosis guides subsequent treatment, including timely administration of thrombolytics or transfer for percutaneous coronary intervention, PCI. While nitroglycerin and morphine are important for pain and vasodilation, obtaining the ECG first provides crucial information to confirm the diagnosis and guide appropriate treatment. Think of it this way: you need to see what's happening in the heart before you can best treat it. Question 10. A client with a nasogastric, NG, tube connected to low intermittent suction complains of abdominal cramping and nausea. What is the initial nursing action? A. Administer an antiemetic as prescribed. B. Increase the suction setting to high. C. Check the patency of the NG tube. D. Irrigate the NG tube with normal saline. Answer: C. Check the patency of the NG tube. This question tests your problem-solving skills related to NG tube management. The keywords abdominal cramping and nausea in a client with an NG tube on suction are strong cues that the tube might be obstructed or not functioning properly. Before administering medication or increasing suction, the nurse must first assess the tube's patency to ensure proper drainage. An occluded tube would prevent gastric contents from being suctioned, leading to fluid backup, distension, and the reported symptoms. For example, similar to a clogged drain, if the tube isn't open, nothing can pass through. Always remember to assess the equipment's function first when symptoms suggest a mechanical issue. Question 11. A nurse is providing discharge teaching to a client with a new prescription for warfarin. Which instruction is essential for the nurse to include regarding dietary considerations? A. You should completely avoid all green leafy vegetables. B. You can eat green leafy vegetables freely, as they have no effect on warfarin. C. Maintain a consistent intake of vitamin K-rich foods. D. Increase your intake of cranberry juice to enhance warfarin's effect. Answer: C. Maintain a consistent intake of vitamin K-rich foods. This question assesses your knowledge of dietary interactions with anticoagulants like warfarin. The keyword essential highlights a critical teaching point for patient safety. Warfarin's anticoagulant effect is directly impacted by vitamin K, which promotes clotting. While clients do not need to avoid vitamin K-rich foods, like green leafy vegetables, they should maintain a consistent daily intake to ensure the medication's effectiveness remains stable, preventing fluctuations in INR, International Normalized Ratio, levels. Inconsistent intake could lead to either excessive bleeding, too little vitamin K, or clotting, too much vitamin K. For example, a sudden large intake of spinach could make warfarin less effective. Always emphasize consistency over avoidance when teaching about warfarin and vitamin K. Question 12. A nurse is caring for a client with a new colostomy. The client is reluctant to look at the stoma and states, "I don't think I can ever manage this." What is the most therapeutic nursing response? A. Many people feel that way at first, but you'll get used to it. B. Let's take it one step at a time. I can show you how to empty the pouch. C. Don't worry, your family can help you with your ostomy care. D. It's important to learn how to care for your colostomy to prevent complications. Answer: B. Let's take it one step at a time. I can show you how to empty the pouch. This question assesses your ability to use therapeutic communication and provide patient education effectively, especially when a client is expressing feelings of overwhelm. The keywords most therapeutic emphasize the need for an empathetic and empowering approach. This response acknowledges the client's feelings indirectly by offering a practical, manageable first step, which can reduce anxiety and build confidence. It avoids minimizing feelings, shifting responsibility, or giving a lecture. For example, breaking down a large task into smaller, achievable steps makes it seem less daunting. Always focus on practical, supportive steps that empower the patient to participate in their care. Question 13. A nurse is assessing a client in the emergency department who reports severe abdominal pain, distension, and no bowel movements for 3 days. On auscultation, the nurse hears high-pitched bowel sounds above the area of discomfort and absent bowel sounds below. These findings are most indicative of which condition? A. Gastroenteritis. B. Appendicitis. C. Bowel obstruction. D. Irritable bowel syndrome. Answer: C. Bowel obstruction. This question tests your ability to analyze cues and identify a critical gastrointestinal condition. The key phrases: severe abdominal pain, distension, no bowel movements for 3 days, and the specific bowel sound findings, high-pitched above, absent below, are classic indicators of a bowel obstruction. High-pitched sounds, borborygmi, occur as the bowel tries to push contents past an obstruction, while absent sounds distal to the obstruction indicate complete blockage. Gastroenteritis typically involves diarrhea, appendicitis presents with localized pain, and IBS involves cramping and altered bowel habits but not typically complete absence of bowel movements or specific obstruction sounds. Recognize these distinct patterns as critical cues for serious conditions like bowel obstruction. Question 14. A nurse is administering an opioid analgesic to a client reporting severe pain. Which assessment is the nurse's priority before administering the medication? A. Blood pressure. B. Pain level. C. Respiratory rate. D. Level of consciousness. Answer: C. Respiratory rate. This question assesses your knowledge of priority assessments when administering opioids, focusing on potential life-threatening side effects. The keyword priority directs you to the most critical assessment for client safety. Opioids can depress the central nervous system, leading to respiratory depression, slowed breathing, which can be life-threatening. Therefore, assessing the client's respiratory rate before administration is paramount to ensure it is within a safe range, typically above 12 breaths per minute. While other vital signs and pain level are important, respiratory depression is the most dangerous immediate risk. Always prioritize ABCs. Airway and breathing are directly affected by opioids. Question 15. A nurse is providing education to a group of older adults about fall prevention at home. Which recommendation is most important for the nurse to emphasize? A. Keep all rooms brightly lit throughout the day and night. B. Install grab bars in the bathroom and use a shower chair. C. Wear loose-fitting clothing and comfortable shoes. D. Engage in regular weight-bearing exercises. Answer: B. Install grab bars in the bathroom and use a shower chair. This question tests your ability to prioritize safety interventions, specifically for fall prevention in older adults. The keyword most important points to the intervention with the highest impact on reducing fall risk in a high-risk area. Bathrooms are notoriously high-risk areas for falls due to wet surfaces and the need for balance. Installing grab bars and using a shower chair directly addresses these risks by providing stability and reducing the need to stand for extended periods on slippery surfaces. While lighting, appropriate clothing, and exercise are beneficial, direct modifications to high-risk environments often have the most immediate impact on fall prevention. Think of it as directly addressing the environmental hazards where falls are most common. Question 16. A nurse is caring for a client with a history of alcohol withdrawal syndrome. The client suddenly becomes agitated, tremulous, and experiences visual hallucinations. What is the nurse's immediate priority? A. Administer prescribed benzodiazepine medication. B. Restrain the client to prevent injury. C. Document the client's symptoms thoroughly. D. Orient the client to reality. Answer: A. Administer prescribed benzodiazepine medication. This question tests your ability to recognize critical cues of a medical emergency and prioritize life-saving interventions. The symptoms described, agitation, tremulousness, and hallucinations, are classic signs of delirium tremens, DTs, a severe and potentially fatal complication of alcohol withdrawal. The immediate priority is to administer prescribed benzodiazepines, which are the cornerstone of treatment, to reduce central nervous system hyperexcitability, prevent seizures, and manage symptoms. While documenting and reorienting are important, medication is crucial to stabilize the client and prevent further deterioration, which could lead to seizures or cardiac events. In this situation, the priority is to chemically calm the agitated brain to ensure safety. Question 17. A nurse is caring for a client with a new permanent pacemaker insertion. Which instruction is most important for the nurse to include in the discharge teaching? A. You can resume all normal activities, including lifting, immediately. B. Avoid using cellular phones, as they can interfere with the pacemaker. C. Report any dizziness, fainting, or swelling at the incision site. D. You will need to have your pacemaker battery replaced annually. Answer: C. Report any dizziness, fainting, or swelling at the incision site. This question assesses your ability to prioritize critical post-procedure teaching for a client with a new pacemaker. The keyword most important focuses on potential complications that require immediate medical attention. Dizziness or fainting can indicate pacemaker malfunction or an underlying cardiac issue, while swelling at the incision site could signal infection or hematoma, all requiring prompt evaluation. Activity restrictions are usually temporary, example no heavy lifting for several weeks, cell phone use is generally safe with precautions, holding to the opposite ear, and battery replacement is typically every 5 to 10 years, not annually. Early recognition of these signs and symptoms is crucial for preventing serious adverse outcomes. Question 18. A nurse is preparing to administer total parenteral nutrition, TPN, to a client. Which action is most important for the nurse to take before initiating the infusion? A. Warm the TPN solution to room temperature. B. Verify the TPN solution against the healthcare provider's order with another nurse. C. Administer an insulin dose based on the client's blood glucose level. D. Change the TPN tubing and filter every 72 hours. Answer: B. Verify the TPN solution against the healthcare provider's order with another nurse. This question highlights a critical safety step in medication administration, specifically for high-alert medications like TPN. The phrase "most important" points to the action that prevents potentially fatal errors. TPN solutions are complex and customized, containing various components that can cause severe complications if incorrect. A two-nurse verification ensures that the specific TPN solution matches the healthcare provider's order for the correct client, preventing errors in composition, dosage, or infusion rate. This double-check is a non-negotiable safety measure, similar to verifying blood products. Think of it as a double-check system for a powerful, customized medication that profoundly impacts the patient's nutrition. Question 19. A nurse is reviewing the lab results for a client with acute kidney injury. The client's potassium level is 6.8 milliequivalent/L. Which manifestation should the nurse prioritize assessing for? A. Muscle weakness and fatigue. B. Tall peak T waves on ECG. C. Diarrhea and abdominal cramping. D. Numbness and tingling around the mouth. Answer: B. Tall peak T waves on ECG. This question assesses your ability to recognize critical cues of a life-threatening electrolyte imbalance. The keyword "prioritize assessing for" directs you to the most dangerous manifestation of hyperkalemia, high potassium, especially when the level is significantly elevated at 6.8 milliequivalent/L. Hyperkalemia can cause severe cardiac dysrhythmias, and tall, peak T waves are an early and critical ECG change indicating impending cardiac instability. While muscle weakness and GI symptoms can occur, cardiac effects are the most immediate threat to life. Therefore, monitoring the heart's electrical activity is paramount. Always prioritize cardiac manifestations when dealing with significant potassium imbalances, as they pose the greatest immediate danger. Question 20. A nurse is caring for a client who is experiencing an anaphylactic reaction after receiving an antibiotic. Which action should the nurse take immediately? A. Administer diphenhydramine intravenously. B. Obtain an arterial blood gas, ABG. C. Prepare for endotracheal intubation. D. Stop the infusion of the antibiotic. Answer: D. Stop the infusion of the antibiotic. This question tests your immediate prioritization in an acute, life-threatening allergic reaction. The keyword immediately points to the fastest and most direct intervention to prevent further harm. The first step in managing an allergic reaction to an infusible substance is to remove the offending agent. Stopping the antibiotic infusion prevents additional exposure to the allergen, halting the progression of the reaction. While administering medications like epinephrine and diphenhydramine and preparing for intubation are crucial subsequent steps, discontinuing the source of the allergen is always the absolute first action. Think of it like this: if something is causing harm, you must stop it before anything else. Question 21. A nurse is providing care for a client with multiple sclerosis, MS, who reports increasing fatigue. Which intervention is most appropriate to help the client manage this symptom? A. Encourage daily strenuous exercise to improve energy levels. B. Suggest taking hot baths to relax muscles and reduce stiffness. C. Advise planning activities to coincide with peak energy times. D. Recommend restricting fluid intake to reduce bladder symptoms. Answer: C. Advise planning activities to coincide with peak energy times. This question assesses your knowledge of managing a common and debilitating symptom of multiple sclerosis, fatigue. The keyword "most appropriate" guides you to a practical and effective strategy. Fatigue in MS is often profound and unpredictable, so pacing activities and utilizing periods of higher energy, example in the morning, can significantly improve a client's ability to complete tasks and maintain quality of life. Strenuous exercise or hot baths can exacerbate fatigue and other MS symptoms, and restricting fluids is inappropriate. For example, if a client feels most energetic in the morning, they should schedule important tasks like bathing or appointments during that time. Helping clients manage their energy effectively is key to living with MS. Question 22. A nurse is educating a client about measures to prevent urinary tract infections, UTIs. Which instruction is most important for the nurse to include? A. Decrease your intake of cranberry juice. B. Limit your daily fluid intake to prevent bladder overdistension. C. Wipe from back to front after urination. D. Urinate before and after sexual intercourse. Answer: D. Urinate before and after sexual intercourse. This question assesses your knowledge of key preventative measures for UTIs. The keyword "most important" highlights the intervention with the highest impact on reducing bacterial entry into the urethra. Urinating before and after sexual intercourse helps flush out any bacteria that may have entered the urethra during activity, significantly reducing the risk of ascending infection. Cranberry juice is often recommended, though its efficacy is debated. It's not discouraged. Limiting fluid intake is detrimental, and wiping from back to front promotes bacterial spread, so these are incorrect. This simple action can help clear the urinary tract and prevent bacteria from settling. Question 23. A nurse is caring for a client with a closed head injury who has a Glasgow Coma Scale, GCS, score of 6. Which intervention should the nurse prioritize? A. Elevating the head of the bed to 30 degrees. B. Assessing pupillary response to light. C. Administering a prescribed stool softener. D. Preparing for endotracheal intubation. Answer: D. Preparing for endotracheal intubation. This question tests your ability to recognize a critical neurological cue and prioritize immediate life-saving airway management. A GCS score of 6 indicates severe neurological impairment, making the client highly vulnerable to airway compromise due to loss of protective reflexes, example gag reflex, cough. The keyword "prioritize" directs you to the most urgent action. Preparing for endotracheal intubation is paramount to secure the client's airway and ensure adequate ventilation and oxygenation, preventing secondary brain injury from hypoxia. While other actions are important for ICP management, securing the airway is the immediate life-saving priority for a severely compromised client. Remember, ABCs always come first, especially when brain injury affects breathing. Question 24. A nurse is preparing to insert a peripheral intravenous, catheter. Which action should the nurse take to ensure proper vein distension before insertion? A. Apply a cold compress to the chosen site. B. Have the client clench and unclench their fist repeatedly. C. apply the tourniquet 2 to 4 inches above the chosen insertion site. D. Rub the client's arm vigorously from distal to proximal. Answer: C. Apply the tourniquet 2 to 4 inches above the chosen insertion site. This question assesses your practical skills in preparing for fore insertion. Applying the tourniquet correctly, 2 to 4 inches above the intended insertion site, is the most effective way to impede venous return while allowing arterial flow, thereby distending the veins. This makes the veins more visible and palpable, improving the chances of a successful insertion. Cold compresses cause vasoconstriction. Clenching/unclenching helps but is secondary to tourniquet placement, and vigorous rubbing can cause vein irritation. Proper tourniquet placement is a fundamental step in ensuring a successful fore insertion. Question 25. A nurse is caring for a client with a history of hypertension. The client's blood pressure is 180/100 mmHg. The client reports a severe headache and blurred vision. Which action should the nurse take first? A. Administer a prescribed oral antihypertensive medication. B. Elevate the head of the bed and provide a quiet environment. C. Notify the healthcare provider immediately. D. Recheck the blood pressure in 15 minutes. Answer: C. Notify the healthcare provider immediately. This question tests your ability to recognize signs of a hypertensive crisis and prioritize rapid reporting. The cues BP 180/100 mmHg, severe headache, and blurred vision indicate a hypertensive emergency, where elevated blood pressure causes target organ damage, brain, eyes. The keyword first emphasizes the urgency of reporting this critical change to the healthcare provider for immediate intervention to prevent further organ damage. While other actions may follow, the provider needs to be aware of the emergent situation to prescribe appropriate rapid-acting medications. Think of these symptoms as red flags that require immediate medical attention, not just routine management. Question 26. A nurse is educating a client about preventing deep vein thrombosis, DVT, after surgery. Which instruction is most important for the nurse to include? A. Remain in bed for the first 48 hours to promote healing. B. Cross your legs when sitting to elevate your feet. C. Perform ankle pumps and foot circles frequently. D. Increase your intake of foods rich in vitamin K. Answer: C. Perform ankle pumps and foot circles frequently. This question assesses your knowledge of effective non-pharmacological interventions for DVT prevention. The keyword most important highlights the intervention that directly promotes venous return and reduces stasis, which are primary factors in DVT formation. Ankle pumps and foot circles actively contract calf muscles, mimicking the action of the calf muscle pump and facilitating blood flow back to the heart, even when a client is relatively immobile. Remaining in bed promotes stasis, crossing legs impedes circulation, and increasing vitamin K could increase clotting risk. This simple exercise is a powerful tool to keep blood moving and prevent dangerous clots. Question 27. A nurse is assessing a 4-year-old child admitted with dehydration. Which finding is the most concerning for the nurse? A. Crying without tears. B. Increased thirst. C. Dry mucous membranes. D. Decreased urine output. Answer: A. Crying without tears. This question tests your ability to recognize critical cues of severe dehydration in a pediatric client. While increased thirst, dry mucous membranes, and decreased urine output are all signs of dehydration, crying without tears is a particularly significant and late sign of severe dehydration in infants and young children, indicating profound fluid depletion. It suggests a more advanced stage of dehydration compared to the other options, which can be present even in mild to moderate dehydration. Always recognize that a lack of tears in a crying child points to a critical fluid deficit. Question 28. A nurse is preparing to administer a blood transfusion. Which client identification method is essential prior to initiating the transfusion? A. Compare the client's armband with the blood bank slip and verbally verify with the client. B. Check the client's medical record number against the blood bank tag. C. Ask the client to state their name and date of birth. D. Verify the blood type on the bag matches the client's blood type. Answer: A. Compare the client's armband with the blood bank slip and verbally verify with the client. This question assesses a critical safety protocol for blood transfusion, focusing on preventing fatal transfusion reactions due to misidentification. The keyword essential highlights the non-negotiable double check. The most critical step is to compare the client's identifying information on their armband, name, date of birth, medical record number, directly with the information on the blood bank compatibility tag and the unit of blood, and then verbally verify this information with the client themselves. This multi-step process, often requiring a second nurse, is crucial to ensure the correct blood product is given to the correct client. This precise verification prevents a tragic error. Question 29. A nurse is caring for a client with a CVA, stroke, who has left-sided weakness and dysphagia. Which intervention is most important to prevent complications? A. Place the client in a supine position after meals. B. Encourage the client to eat quickly to ensure adequate intake. C. Provide thickened liquids and pureed foods. D. Allow the client to use a straw for drinking liquids. Answer: C. Provide thickened liquids and pureed foods. This question addresses the priority intervention for a client with dysphagia, difficulty swallowing, following a stroke. The keyword most important emphasizes the crucial action to prevent aspiration, a common and potentially life-threatening complication of dysphagia. Thickened liquids and pureed foods are easier to control in the mouth and swallow, reducing the risk of food or liquid entering the airway. Supine positioning, eating quickly, and using straws all increase the risk of aspiration. For example, thin liquids like water are much harder for someone with dysphagia to control than a thickened drink. This simple dietary modification protects the client's airway. Question 30. A client with a new prescription for metformin for type 2 diabetes asks the nurse, "What are the common side effects I should know about?" Which information is most important for the nurse to provide? A. You might experience increased urination and thirst. B. You should avoid taking this medication with food. C. Gastrointestinal upset like diarrhea and nausea is common. D. You may notice a significant weight gain while on this medication. Answer: C. Gastrointestinal upset like diarrhea and nausea is common. This question assesses your knowledge of common and important side effects of oral hypoglycemic agents, specifically metformin. The keywords most important guide you to a frequently experienced side effect that can impact client adherence and comfort. Gastrointestinal upset, including diarrhea, nausea, and abdominal cramping, is a very common initial side effect of metformin. Informing the client helps them anticipate and manage this, often by taking the medication with food or starting with a low dose and gradually increasing it. Metformin typically does not cause increased urination/thirst, those are symptoms of hyperglycemia, or weight gain, and it should generally be taken with food. Managing these initial side effects is crucial for client adherence. Question 31. A nurse is assisting with the admission of a client who is unconscious and was brought in by ambulance after a motor vehicle accident. The client has no family present. What is the nurse's ethical obligation regarding the client's care? A. Wait for the family to arrive to obtain consent for treatment. B. Provide necessary emergency treatment without consent. C. Obtain a court order to initiate life-saving interventions. D. Consult with the hospital's ethics committee before proceeding. Answer: B. Provide necessary emergency treatment without consent. This question tests your understanding of ethical principles, specifically implied consent in emergency situations. In an emergency where a client is unconscious and unable to provide consent, and no authorized decision-maker is immediately available, the ethical principle of beneficence, doing good, and the legal principle of implied consent allow healthcare providers to proceed with necessary life-saving treatment. Delaying care to obtain consent would violate the duty to preserve life and prevent harm. For example, if a client is bleeding profusely and unconscious, the nurse must act immediately to stop the bleeding. The priority is to save a life first. Question 32. A nurse is caring for a client with a history of falls who is confused. Which action should the nurse include in the client's plan of care to prevent injury? A. Administer a sedative to keep the client calm. B. Apply restraints to the client's extremities. C. Keep all 4 side rails up on the client's bed. D. Place the client in a bed with a low position and activate bed alarms. Answer: D. Place the client in a bed with a low position and activate bed alarms. This question assesses your knowledge of fall prevention strategies, especially for a confused client, emphasizing least restrictive interventions. The keyword prevent injury directs you to the safest and most appropriate intervention. Placing the bed in a low position reduces the distance of a potential fall, while bed alarms alert staff immediately if the client attempts to get out of bed independently, allowing for prompt intervention. Sedation and restraints should be avoided due to potential harms and legal implications, and all 4 side rails up can be considered a restraint in some facilities and may increase injury if the client tries to climb over. The goal is to provide safety without limiting the client's freedom unnecessarily. Question 33. A nurse is evaluating the effectiveness of pain medication administered to a client. Which assessment finding best indicates the medication has been effective? A. The client is asleep. B. The client states, "My pain is 2 out of 10. C. The client's vital signs are within normal limits. D. The client is watching television. Answer: B. The client states, "My pain is 2 out of 10. This question tests your understanding of pain assessment and evaluation, emphasizing the subjective nature of pain. The keywords best indicates and effective highlight the most direct measure of pain relief. Pain is a subjective experience, and the client's self-report is the most reliable indicator of their pain level. A decrease from a higher pain score to 2 out of 10 directly confirms that the medication has achieved its intended effect of reducing pain. While the other options may be related to comfort, they do not directly confirm pain relief. Always remember to ask the patient about their pain level. Their report is the gold standard for pain assessment. Question 34. A nurse is preparing to administer potassium chloride, KCl, intravenously to a client with hypokalemia. Which action is most important for the nurse to take before initiating the infusion? A. Dilute the KCl in a large volume of normal saline. B. Administer the KCl as a rapid intravenous push. C. Ensure the client has a urinary output of at least 30 milliliters per hour. D. Mix the KCl with other medications in the same syringe. Answer: C. Ensure the client has a urinary output of at least 30 milliliters per hour. This question assesses a critical safety precaution for administering potassium intravenously. The keyword most important emphasizes a non-negotiable step to prevent life-threatening hyperkalemia. Adequate urinary output is essential before administering intravenous potassium because the kidneys are responsible for excreting excess potassium. If kidney function is impaired and urine output is low, potassium can accumulate rapidly in the body, leading to dangerous hyperkalemia and potentially fatal cardiac dysrhythmias. Potassium should always be diluted and never given as a rapid push. Ensuring good urine output prevents a dangerous buildup of potassium in the body. Question 35. A nurse is providing discharge teaching to a client with peripheral artery disease, PAD. Which instruction is most important for the nurse to include regarding foot care? A. Inspect your feet daily for any breaks in the skin. B. Wear tight-fitting socks to promote circulation. C. Soak your feet in hot water to relieve discomfort. D. Trim your toenails with a razor blade for precision. Answer: A. Inspect your feet daily for any breaks in the skin. This question addresses a critical component of client education for peripheral artery disease, PAD, to prevent severe complications. The keyword "most important" highlights the intervention that can prevent infection and ulceration, which clients with PAD are highly susceptible to due to poor circulation. Daily inspection allows for early detection of any skin breakdown, cuts, blisters, or signs of infection, enabling prompt treatment before minor issues escalate into limb-threatening complications. Tight socks impede circulation, hot water can cause burns, due to decreased sensation, and sharp objects for nail care risk injury. Vigilant foot inspection is key to preventing serious infections and amputations. Question 36. A nurse is caring for a client with a large, oozing wound. The nurse observes yellow, thick drainage from the wound. Which term best describes this type of drainage? A. Serous. B. Sanguineous. C. Serosanguineous. D. Purulent. Answer: D. Purulent. This question tests your ability to recognize and correctly identify different types of wound drainage, which is crucial for assessing wound healing and potential infection. The description, yellow, thick drainage, is the classic characteristic of purulent exudate, commonly known as pus. This type of drainage often indicates the presence of infection. Serous drainage is clear/straw-colored, sanguineous is bright red, fresh blood, and serosanguineous is pink/red tinged. Understanding the characteristics of wound drainage helps the nurse assess the wound status and report findings accurately. Think of purulent and pus as going hand in hand, often signifying an infection. Question 37. A nurse is providing care to a client receiving chemotherapy who develops stomatitis, inflammation of the mouth. Which intervention is most appropriate for the nurse to recommend? A. Eat spicy and acidic foods to stimulate appetite. B. Use an alcohol-based mouthwash frequently. C. Rinse mouth with a saline solution several times a day. D. Use a hard bristle toothbrush for oral hygiene. Answer: C. Rinse mouth with a saline solution several times a day. This question addresses a common and painful side effect of chemotherapy and how to manage it. The keyword "most appropriate" guides you to the most effective and gentle intervention for stomatitis. Rinsing the mouth with a non-irritating solution like saline several times a day helps to keep the oral mucosa clean, reduce inflammation, and promote healing without causing further irritation or drying. Spicy/acidic foods, alcohol-based mouthwashes, and hard bristle toothbrushes would all worsen the pain and irritation of stomatitis. Regular, gentle oral hygiene is crucial for comfort and preventing infection. Question 38. A client with a history of schizophrenia is admitted to the psychiatric unit. The client states, "The government is spying on me through my television." Which response by the nurse is most therapeutic? A. That's not true. The government doesn't spy on people. B. I understand you believe that, but I don't see anything on the television. C. Why do you think the government is spying on you? D. Let's talk about something else. What's your favorite hobby? Answer: B. I understand you believe that, but I don't see anything on the television. This question tests your ability to use therapeutic communication with a client experiencing delusions. The keyword most therapeutic indicates the need for a response that validates the client's feelings while gently reorienting them to reality. This response acknowledges the client's perception, "I understand you believe that," but then provides reality without arguing or challenging the delusion directly, "But I don't see anything on the television." Arguing, A, asking why, C, or changing the subject, D, are non-therapeutic as they either invalidate the client, demand a rational explanation for an irrational belief, or avoid the client's reality. This approach validates the client's experience while subtly providing a different perspective. Question 39. A nurse is performing a focused assessment on a client admitted with a suspected urinary tract infection, UTI. Which symptom is most indicative of a UTI? A. Flank pain and fever. B. Dysuria and urinary frequency. C. Nocturia and polyuria. D. Generalized malaise and fatigue. Answer: B. Dysuria and urinary frequency. This question assesses your ability to recognize the classic symptoms of a lower urinary tract infection. The keyword most indicative points to the cardinal symptoms. Dysuria, painful urination, and urinary frequency, needing to urinate often, are the hallmark signs of a UTI, directly related to bladder and urethral irritation caused by bacterial presence. While flank pain and fever might indicate an upper UTI, pyelonephritis, and nocturia/polyuria are not specific to infection, these are the most common and direct indicators of a lower UTI. When a patient complains of burning with urination and constantly needing to go, a UTI should be suspected. Question 40. A nurse is providing education to a client with a new colostomy about pouch management. Which instruction is most important for the nurse to include? A. Change the pouch system every day to prevent odor. B. Empty the pouch when it is 1/3 to 1/2 full. C. Use adhesive removers generously to prevent skin irritation. D. Cut the skin barrier opening significantly larger than your stoma. Answer: B. Empty the pouch when it is 1/3 to 1/2 full. This question assesses your knowledge of practical colostomy care, focusing on preventing complications and maintaining integrity. The keyword most important highlights the instruction that directly prevents leakage, odor, and skin irritation. Emptying the pouch when it is 1/3 to 1/2 full prevents it from becoming too heavy and pulling away from the skin, which could lead to leaks and subsequent skin breakdown. Changing the pouch too frequently can irritate the skin, excessive adhesive removers aren't recommended, and a too large opening exposes skin to corrosive output. This simple habit prevents significant discomfort and skin issues. Question 41. A nurse is assessing a client admitted with a diagnosis of hyperglycemia. Which finding would the nurse expect to observe? A. Bradycardia and hypothermia. B. Nausea and decreased appetite. C. Kussmaul respirations and fruity breath odor. D. Pallor and clammy skin. Answer: C. Kussmaul respirations and fruity breath odor. This question tests your ability to recognize classic signs of severe hyperglycemia, specifically diabetic ketoacidosis, DKA. The keywords expect to observe point to the common clinical manifestations. Kussmaul respirations, deep, rapid breathing, are the body's attempt to blow off excess carbon dioxide to compensate for metabolic acidosis, while a fruity breath odor results from the breakdown of ketones. These are distinct signs of DKA, a life-threatening complication of uncontrolled hyperglycemia. Bradycardia/hypothermia and pallor/clammy skin are typically associated with hypoglycemia, while nausea/decreased appetite can be present but are not as specific. Recognizing these specific respiratory and odor cues is vital for timely intervention. Question 42. A nurse is caring for a client who is NPO, nothing by mouth, for an upcoming surgical procedure. The client requests a glass of water. What is the most appropriate nursing response? A. You can have a small sip of water, but nothing more. B. I understand you're thirsty, but it's important not to drink anything before your surgery. C. Drinking water won't hurt, but I'll check with the doctor first. D. You can have some ice chips, but be careful not to swallow them. Answer: B. I understand you're thirsty, but it's important not to drink anything before your surgery. This question assesses your ability to use therapeutic communication while adhering to critical safety protocols. The keyword "most appropriate" directs you to a response that acknowledges the client's discomfort while firmly and clearly explaining the rationale for the NPO status. Consuming anything orally before surgery can increase the risk of aspiration during anesthesia. The response validates the client's feeling, "I understand you're thirsty," but maintains the safety boundary by explaining the importance of the restriction, "It's important not to drink anything." This approach is empathetic, clear, and prioritizes client safety. Question 43. A nurse is preparing to administer medications through a client's gastrostomy tube. Which action should the nurse take first? A. Crush all medications together and mix with water. B. Check for gastric residual volume. C. Administer each medication separately, flushing with water between each. D. Place the client in a supine position to prevent reflux. Answer: B. Check for gastric residual volume. This question tests your knowledge of safe medication administration via gastrostomy tube. The keyword "first" indicates the crucial initial assessment. Before administering any substances into the gastrostomy tube, the nurse must check for gastric residual volume, the amount of undigested formula or stomach contents remaining in the stomach. A high residual volume could indicate delayed gastric emptying, increasing the risk of aspiration or abdominal distension if more is added. Medications should generally be administered separately, and the client should be in a semi-Fowler's position, not supine. Checking residual volume is a critical safety step to prevent complications. Question 44. A nurse is conducting discharge teaching for a client prescribed a new loop diuretic. Which instruction is most important for the nurse to include? A. Take this medication at bedtime to help you sleep. B. Increase your intake of sodium to prevent dehydration. C. Report any signs of muscle weakness or irregular heartbeats. D. Expect your urine to turn orange or reddish-brown. Answer: C. Report any signs of muscle weakness or irregular heartbeats. This question assesses your knowledge of potential adverse effects of loop diuretics and the most critical client education. The keyword "most important" highlights a symptom indicating a serious electrolyte imbalance. Loop diuretics promote the excretion of potassium, potentially leading to hypokalemia, low potassium. Muscle weakness and irregular heartbeats are classic signs of hypokalemia, which can lead to life-threatening cardiac dysrhythmias. Taking it at bedtime would interrupt sleep, increasing sodium is contraindicated, and urine color change is not a side effect of loop diuretics. Always advise clients to report signs of potassium imbalance when taking diuretics. Question 45. A nurse is performing a pain assessment on a client. Which question is most effective in assessing the quality of the client's pain? A. How severe is your pain on a scale of 0 to 10? B. When did your pain start? C. Can you describe what your pain feels like? D. What makes your pain better or worse? Answer: C. Can you describe what your pain feels like? This question assesses your understanding of comprehensive pain assessment components. The keyword "quality" specifically refers to the characteristic description of the pain. Asking the client to describe their pain, example sharp, dull, throbbing, burning, crushing, provides information about the quality, which can offer clues about the underlying cause. A 0 to 10 scale measures intensity. When asked about onset, and better or worse assesses aggravating/alleviating factors. To truly understand the quality of pain, you need descriptive words. Question 46. A nurse is reinforcing teaching with a client about the benefits of smoking cessation after a myocardial infarction. Which statement by the client indicates an understanding of the teaching? A. I can continue smoking as long as I reduce the number of cigarettes. B. Quitting smoking will only benefit my lungs, not my heart. C. Stopping smoking will reduce my risk of another heart attack. D. I will switch to e-cigarettes as a safer alternative. Answer: C. Stopping smoking will reduce my risk of another heart attack. This question assesses the client's understanding of key health promotion principles following a major cardiac event. The phrase indicates an understanding means you're looking for the correct, positive impact of the teaching. Smoking is a major risk factor for cardiovascular disease, and cessation significantly reduces the risk of recurrent myocardial infarction and other cardiac events. Reducing cigarette count, only benefiting lungs, or switching to e-cigarettes are misconceptions or less effective strategies. The client's statement about reducing the risk of another heart attack demonstrates a clear understanding of the most significant benefit related to their specific diagnosis. Question 47. A nurse is caring for a client with a history of liver cirrhosis who is exhibiting confusion, hysterexis, flapping tremors, and phader hepaticus, musty breath. These findings are most indicative of which complication? A. Esophageal varices. B. Hepatic encephalopathy. C. Spontaneous bacterial peritonitis. D. Acute liver failure. Answer: B. Hepatic encephalopathy. This question tests your ability to recognize a critical complication of liver cirrhosis by analyzing specific neurological and physical cues. The combination of confusion, hysterexis, and phader hepaticus are classic signs of hepatic encephalopathy, a brain dysfunction caused by the liver's inability to remove toxins, like ammonia, from the blood. While other options are complications of cirrhosis, these specific neurological signs point directly to encephalopathy. For example, the ammonia buildup acts like a neurotoxin, impairing brain function. Recognizing these distinctive signs helps the nurse prioritize interventions to lower ammonia levels. Question 48. A nurse is preparing a client for discharge after treatment for a deep vein thrombosis, DVT. The client will be going home on enoxaparin, Lovenox, injections. Which instruction is essential for the nurse to provide? A. Inject the medication into the muscle of your upper arm. B. Rub the injection site vigorously after administration to ensure absorption. C. Administer the injection into the subcutaneous tissue of your abdomen. D. Expect bruising and severe pain at the injection site. Answer: C. Administer the injection into the subcutaneous tissue of your abdomen. This question assesses your knowledge of safe and effective administration of subcutaneous anticoagulants. The keyword essential highlights the critical instruction for correct drug delivery. Enoxaparin is a low molecular weight heparin administered subcutaneously, typically in the anterolateral or posterolateral abdominal wall, to ensure proper absorption and minimize discomfort. Intramuscular injection can cause hematoma formation and erratic absorption, rubbing the site can cause bruising, and severe pain/bruising are not expected if administered correctly. Correct injection technique is vital for the medication's effectiveness and client safety. Question 49. A nurse is caring for an older adult client who recently experienced a hip fracture. The client is prescribed opioid analgesics for pain. Which adverse effect is the nurse most concerned about in this client population? A. Nausea. B. Constipation. C. Pruritus, itching. D. Dry mouth. Answer: B. constipation. This question tests your ability to identify a common and often problematic adverse effect of opioid analgesics, particularly in older adults. While nausea, pruritus, and dry mouth are common side effects, constipation is singled out as the most concerned about because it is nearly universal with opioid use, can be severe and debilitating, and older adults are already prone to constipation due to decreased motility and fluid intake. Unmanaged opioid-induced constipation can lead to impaction, bowel obstruction, and significant discomfort. Nurses must proactively manage this side effect to prevent complications. Question 50. A client with a new diagnosis of hypertension asks the nurse, "What lifestyle changes can I make to help lower my blood pressure?" Which recommendation is most beneficial for the nurse to suggest? A. Eliminate all salt from your diet. B. Increase your intake of red meat and dairy products. C. Engage in regular aerobic exercise for at least 30 minutes most days of the week. D. Stop taking your prescribed medications if your blood pressure improves. Answer: C. Engage in regular aerobic exercise for at least 30 minutes most days of the week. This question assesses your knowledge of evidence-based lifestyle modifications for hypertension. The keyword "most beneficial" highlights the intervention with the strongest positive impact. Regular aerobic exercise, like brisk walking, swimming, or cycling, is a highly effective non-pharmacological intervention proven to significantly lower blood pressure and improve overall cardiovascular health. While sodium reduction is important, complete elimination is often unrealistic and not the only factor. Increasing red meat and dairy is unhealthy, and stopping medications without provider consultation is dangerous. Consistent physical activity is a cornerstone of hypertension management.